This concept of non-metastatic castration-resistant prostate cancer is a concept which is, these are patients which have been around for a while. They're actually probably a diminishing group of patients, and that reflects a number of factors. I think in particular it reflects the fact that we are less likely to use androgen deprivation therapy as a sole treatment for men with non-metastatic prostate cancer today than we were previously. And I think also with modern imaging techniques, actually a lot of these patients are now being labelled, now being found to have metastatic disease. So whether this is truly a discrete group of patients or not, I think is open to question. Nonetheless, we still have these patients in the clinic who, by conventional imaging, bone scan and CT scan, have no evidence of metastatic disease. They have a rising PSA, and we know that they're at risk of running into trouble. And I guess the unique thing here is that these are patients who are well, and the problem is the numbers rather than the symptoms, and of course the knowledge that there is this sword of Damocles hanging over them, that they are given enough time, they are going to run into metastatic disease, and then will run into symptomatic progression and likely death from prostate cancer. And I guess there's a danger of over-treatment for these patients. We to date don't have curative therapy for these men, so the treatments are palliative. And the question is about really balancing the positive impacts in delaying symptomatic disease versus the negative impacts of giving extra treatment and all the side effects, etc. of that. And of course, added to that, we are now much better at treating the metastatic disease when it occurs, and of course we like to treat those patients before they develop significant symptoms. So I guess one of the questions we have with these studies that have been done here is, which have been shown to delay the onset of metastatic disease, is that in its own right a meaningful endpoint? So both trials that have been done in that arena, both the successful trials that have been done in that arena, have demonstrated a significant reduction in the risk of metastatic disease. Neither has yet shown an overall survival benefit, and indeed that was not the primary endpoint of either study. However, both studies do show a significant trend towards a survival benefit, and I think if that comes through, then it justifies these treatments for these men, because what it tells you is that you're better treating it early rather than waiting to develop metastatic disease and then treating the metastatic disease.